You are awesome.
I just want to know what is other way for me to just don't put too much weight in my back.
That's why you're here today. Yes, we're gonna go over that techniques for that. Yeah.
Great, thank you.
How about you, young man?
Mine, I have one main person, and he's pretty ambulatory. And in the past, when after surgeries or whatnot, we've always relied on the gait belt too.
Okay. Wonderful.
Yes,
Right.
I also have a 92-year-old woman that she was ambulatory before, but in December she fell. So after that, we need to, the lifting and the transferings. That happened 2 months ago, and we've been learning with the physical therapist all the tricks to lift her, and she's doing very good.
Wonderful. Wonderful.
Yeah, and
Okay.
I always use my belt and the belt for her too, because I have a problem with my lower back, and it's important with the client only to use the belt. It feels a big support.
Yes. So good. So you're gonna get a lot out of this then, having an issue yourself. Wonderful. Hi.
I only have one main client who's been diagnosed with Agent Orange. He's about 260, so he's very, very stiff.
Okay.
He can't stand at all. So I always use the gait belt with him, always use my legs, tighten my stomach muscles. So
Okay.
I don't have a problem transferring
big
him,
guy.
but he's a big dude. So.
Yeah. Wow. All right. How about you, Ethan?
I've got a handful of clients. I think one of them just went into definitive care. He was blind. He had a walker, but he got around okay, a little unsteady footing. I just walked side by side with him. And main obstacle with him was kind of curves and things like that.
Okay.
Probably the biggest, my main client now has multiple sclerosis, so non-ambulatory, so there's a lot of transfers. Got a Warrior lift, transfer from bed to chair, chair to couch, or one transfer that I've been kind of struggling with. What's the best way to do it is into the car, from the wheelchair into the car. So that's a tough one. I want to maybe see if I could get some pointers on how to do
Okay.
that.
Yeah. Definitely. I think, simulating it might be a little difficult, but if you use the skills, you can use them in various environments. Is what we're going to get at. And the reason why I'm asking you all who you're working with is because, and sir, she's definitely going to agree with this, is you want to utilize any strength from that individual that you're working with. The stress should not be on you, it should not be on your back. So facilitating the action is what's most important. Talking to them, knowing where to place their feet, okay, use those legs, here's where our power is for transfers. Getting up, moving to a chair or to a wheelchair or to the car, utilizing that individual's strength so that it's not all on yourself. So that's the reason why I'm asking you, who you're working with. Sorry, what's your name?
Hi, I'm Sherry.
Hi, Sherry.
Hi.
Jay and Heather.
Hi.
We're just talking about the type of clients that you work with. What type of client do you work with as far as functional
Not
client?
transferring and lifting.
No.
However, I just got back from LA helping my mom who's in a serious car accident, and she's relearning how to walk, gait belt. So I knew how to do that from years ago, but let me tell you, I ended up seeing my chiropractor
Okay.
just because I don't do that anymore. So I just went into automatic mode of helping her.
Whichever how you
What I did what I had to do,
Yeah.
and I was down there for 2.5 months. So you just do what you do, and I needed to see the chiropractor in May
Okay.
before I left.
Sure. Okay. Well, hi Mara.
Hi.
Everyone, this is Mara. She's a student, PTA, so she will be here doing what we're doing. She will be doing what we're doing, literally, when she graduates. So what we're going to do is we're going to break this into two different sessions. I'm going to educate you guys on how to lift properly, and that's lifting anything over 10 pounds. There's a way that you should lift, and recruiting certain muscle groups to improve your stability of your spine. And that same lifting technique is what you guys are going to use when you're transferring and all of those things. So she is going to do the transferring section of this. She has experience in acute care, so she did all of that for 2 years with dependent patients, patients that had very little ability and function. So she is a pro at that. So she's going to take over that portion. And what our plan is today, really quick, is to show you guys these things, give you these tools and tasks to use, and then we're going to do it. I mean, the best way to learn is to do it. So we're going to spend a short amount of time showing you. You guys can ask questions as we go, and then we'll split you up into groups and kind of work together and do transfers and do lifting. So, and then at the end, we'll have a little question and answer, and if you guys have questions, you can answer all your questions. That sound cool?
Okay.
Okay. So what we're going to do is those papers you guys have in your laps are lifting techniques. And so I'm basically kind of going to run down what you're reading right there, okay? The important thing in lifting is, first of all, to have a base. So your feet are your base. Your legs are your base. As you narrow your feet together, your base diminishes, balance is compromised, you end up putting more stressors on muscle groups. So you want to start with a large base, wide base. In that paper, it actually talks about staggered the foot position. So what you want to do is you start with a base. You can get close to whatever you're lifting, okay? You want to be close to it. So here's my base. So what I'm going to do is I'm going to use my legs, bend at the knees and not my waist, to pick this box up. First thing that you want to do with any transferring or lifting is engage your abdominal muscle group. Very, very important. It's easy to do. You're just really pulling your belly button in towards your spine, and that tightens up all of the muscles around your spine to support your spine with movement. So you have your base, you engage your abdominal muscles, you pull your stomach, your belly button in towards your spine, you bend at the knees, you keep a nice upper torso. I'm grabbing and I'm lifting using my legs and not my waist. Okay. With this box, it's pretty easy to do. Okay. The concept you're going to have to use with all of the tasks that you're doing. Now again, with humans, you're going to put yourself in a compromised position. Transfers into cars are difficult. You're going to find these tools are going to be a little hard to do. So, again, base, engage your abdominal muscles. I'm bending at my legs, not my waist. Grabbing, keeping the item close to your body. People, the farther away an object gets, whether it's a weighted box or a person, that weight increases. So you want to keep everything that you're lifting or helping as close to your body as you possibly can. So, engaging the abs, a nice firm base, bending at the knees, not at the waist, picking up close to your body. In a nutshell, I mean, it doesn't get any more basic than that, okay? But what you guys are going to end up doing also is now you're twisting and turning. I mean, this is literally mechanics for picking something up off of the ground or proper lifting mechanics. So, with that, you're going to take those concepts, the engagement of your abs, your nice firm base, you're bending at the knees, not at the waist, and incorporate those techniques with transferring. So, of course, with transferring, you're talking about twisting and things like that. So it's even more important that you really focus on engaging those abdominal muscles, because once you start twisting, your spine really needs support. And so, you know, myself, not really as strong in my core as I would like, especially for what you guys do. So you make up for that by recruiting those muscle groups. So in a nutshell, that should be your focus. Base, engaging the abs, and then when we go into transferring, trying to utilize those tools as safely as possible with your transferring. Okay. Does that sound okay? Do you guys mind like standing up and individually showing me that? One at a time? Putting yourself on stage? Yeah. All right. Ethan. You are picking up a 15-pound box.
Nice base, right? Engage the abdominals.
Perfect.
Bend at the knees. Keep your back straight. Keep the weight close to your body.
In a nutshell, that's it. Perfect.
All right.
Same thing with going down.
Bring it down.
Exactly. Perfect. Pretty simple?
Yep.
Yep. It's very simple. It's really, here is where it all is. I mean, when you're out working, it's mentally thinking about these techniques that's gonna, you know, improve your decrease your ability, your risk of injury. Okay, here we go.
Leg stance. Out of the knees, back straight.
Engage the tummy.
Engage the tummy.
Perfect.
Alright.
Same mechanics going down. Perfect. Engaging the abdominal muscle. Super important. If
Okay.
you don't do that, you're allowing for more movement of your spine. So
Right.
not just the base, but really focus on engaging the stomach. And it's easy to do. You just pull your belly button in, literally.
Okay.
Good job. All right, next. So you, for sure, have to really focus on the abs and your mechanics because you have a history of something in your lower back,
Lower
right?
back
Yes.
problems.
Okay. Get really close to the object.
Close to the object, a good base of sustentation and abdominals tight.
Perfect. Excellent. Now with,
Same.
yep, same thing. Same pattern.
The
Excellent.
knees.
Okay, so there's one thing I didn't like.
Okay.
Anybody see it?
No, it's not, okay,
The neck. So right there.
all the neck,
That.
okay.
This is completely unnecessary.
Okay,
You actually
so
want
I
to
can-
keep
I
it
can
neutral
just-
and look at what you're lifting.
Okay.
Because that will save you through here, because that's a lot of stress pulling up.
Mm-hmm.
Do it, okay, the same direction.
Much better.
Much better. Much better.
I feel.
So what she's referring to is
Feels
cervical
nice,
stress
right,
down
Yeah,
there. So
definitely.
you're really
Thank you.
extending, you get a little more stress on your neck.
How do you feel about lifting 15 pounds?
Huh, I lifted over what? Oh, wait a minute.
Try it once,
Yes.
let's see how it does, and then we'll give you the 5 pound back.
Nice
I
base.
don't want to ruin the chiropractor's work.
Engage.
Let's look back.
Good base.
So you sit here.
Pull in the tummy, yeah. Perfect. Keep it close to your body. Use the same technique going down, bend at the legs. Excellent.
You
Way
might, I
too
might
easy,
have done
right?
that with my mom. I so don't remember. I went into
Alright, so you get one more.
And for longevity of employment,
I don't remember.
you want to remember, remind yourself. It's not, you don't want to go into that mode, where it's easy to do. Where you go in and you visit your clients and it's this, and this. It's easy to just, all right, let's get you here, let's take you
Don't
here.
worry about it, I won't.
But it does not take very much to really have a severe back injury, and those are,
In a second.
yes, and they're very problematic, and it will probably become a chronic thing. So
That was 10.
focus.
So this is now 15.
All right, nice base, a little bit wider. Perfect. Engage your abs. Okay. Same. Perfect. Excellent.
That was good.
Good job.
Good form there.
Shoe attire. Is there any shoe attire that Can you wear heels, or do you have to wear tennis shoes, or so tennis shoes?
Well, I know
Yeah.
these are wrong.
I'm just since you had them on, I decided to just talk about that. Yes. Good job, though. All right.
Oh,
So the ones on the back, you guys get an advantage. You get to see all the things that we are pointing out.
Good job.
Perfect. Engage those abs.
Yeah. Well,
Wonderful.
I work with the physical therapist and I'm a kinesiology student, so I'm kind of cheating.
What? No, you're not cheating. Good. Good job. Nice base.
Thanks.
Engaging the abs. Perfect. All right. Okay. Let's try that one more time. Okay.
It doesn't matter because I'm bigger?
Nope.
I mean, it's,
Does not matter. You have more distance. That's the unfortunate thing for you, is you have to bend your knees farther than some of us non.
short and tall.
Exactly.
Tall people.
But what you want to do is when